Welcome to this video on sepsis documentation. Sepsis is one of the most commonly denied diagnoses in the hospital. In the next few minutes, you will learn a simple format that makes your sepsis documentation specific, criteria-based, and defensible. Let's get started. Sepsis is a complicated, targeted diagnosis that payers scrutinize heavily. Vague notes are the #1 reason claims are denied. We can win these denials by using clear, specific criteria in our documentation, including a named source of infection and documenting all organ dysfunction. Build every sepsis note using these 5 parts: sepsis with vitals and labs in parentheses, the source of infection, end organ dysfunction, shock, and the SOFA score. Note that you should only include the SOFA score if it is greater than or equal to 2. Understanding definitions is key. SIRS requires at least 2 of the following: abnormal temperature, heart rate, respiratory rate, or white blood cell count. Sepsis is SIRS plus infection, or a SOFA score greater than 2. Severe sepsis is sepsis with associated end organ dysfunction. Septic shock is defined as hypotension refractory to fluid resuscitation. This includes a systolic blood pressure less than 90, a MAP less than 70, or a significant drop from baseline. Also, a lactate level greater than 4 is considered shock when not due to another cause. Use this translation table to turn clinical findings into formal diagnoses. For example, document altered mental status as metabolic encephalopathy due to sepsis, and low oxygen levels as acute respiratory failure. Using precise terminology is essential to supporting your diagnosis in the chart. The SOFA score assesses 6 organ systems: respiration, coagulation, liver, cardiovascular, CNS, and renal. A score greater than 2 indicates sepsis. Remember, document the score only when it reaches this threshold, and be sure to itemize every point considered in your assessment. Here are 2 examples of an assessment and plan. The first is a straightforward sepsis case, while the second illustrates severe sepsis with shock, including a specific SOFA score. Follow this formula to ensure your documentation is complete and defensible. Avoid terms that often trigger queries. Phrases like urosepsis or sepsis syndrome are not ICD-10 acceptable. Instead, use specific terminology like sepsis due to UTI, or simply document sepsis if the clinical criteria are met. 3 more common pitfalls. Avoid ambiguous phrases about the relationship between conditions. Clarify that septic is not synonymous with sepsis, and never document septic shock without first diagnosing sepsis. Always name the type of shock and the underlying source of infection. The takeaway is simple: name it, prove it with criteria, and plan it. Use the 5-part formula to ensure your sepsis documentation is clear and accurate. Thank you for watching this guide to improving your clinical documentation.